Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is trauma to face. We will discuss this topic in three sections. In the first section, we will talk about soft tissue injuries and the fractures of the face, and how we can manage the fractures of the face, and if there are any soft tissue injuries, what are different facial fractures and what's the fractures of upper third of the face. So upper third of the fractures we will discuss in the first section of our lecture. Then in the second section we will talk about the fractures of the middle third of the face, and in this we will talk about fractures of the nasal bone and septum, naso-orbital, zygoma and zygomatic arch fractures. All these bones are present in the middle third of the face. So when we will talk about the fractures of the middle face, we will talk about especially these bones which make up the middle face. Then also fractures of orbital floor and maxilla. Then in the third section, we will talk about fractures of the lower third of the face, which constitute the mandible mainly. So we will go over the fractures of the mandible and also oroantral fistula. So all this will cover our today's lecture topic, trauma to face. So keep watching sqadia.com to learn about this topic.